Well, welcome everybody. So today we are going to be talking a little bit about low pressure fitness, which is a really cool technique that we'll go into a little bit later. First and foremost, I wanted to, one, welcome you all and thank you for joining us today. And then go through a little bit about, who we are so you understand kind of who's in the room, who's going through this with you. So my name is Melissa Jimenez. I am the founder of Making Strydz. So I am a certified personal trainer and a nutrition coach in beautiful Colorado, Castle Rock area. I know we have some folks joining from other states as well. So basically, I focus on functional training with my clients. I have a private studio. I am a veteran and a cancer survivor, and that is what really kind of sets this low pressure fitness apart from a lot of the other techniques that are out there. So I have one lung. So of course, breathing is very crucial and vital to what it is that we do. So really cool technique that we'll be getting into. And then most of my clients are women. So I see clients between the ages of typically right now it's like 30 to 80. And then I am also a certified pronatal fitness coach. So I also have a specialization in prenatal and postpartum. So I work with a lot of mamas as well during pregnancy and post. With me is Dr. Ashlea Lytle, so a dear friend of mine who is a physical therapist. So I will let her kind of introduce herself.
Yeah, so I'm Ashlea Lytle. I also work in Colorado, down in Castle Rock and in our Littleton location. So I work for a company called ActivCore. I have my own LLC called MyoFlow, where I teach a lot of this low pressure fitness. And I actually recently started teaching this to other practitioners and providers here in the last month. So I started taking this course probably, I think, 3 years ago. And I will say I'm a pelvic floor PT. A lot of my clients totally changed. So I used to do the traditional Kegels and belly breathing and all of that stuff to my clients. And people did get better, but it just took a little bit, I think, longer. Where now I feel like adding in this breathing technique, you're actually seeing kind of results pretty quickly. And it's nice because people can do this at home. So it's not like they have to come in. I'm obviously cash-based and out of network. So I know it's pricey to come in and see me in person sometimes. So it's nice to be able to do sessions and then have the client go home and be able to do this technique themselves. And then I do some online classes with low pressure fitness. I do an online class on the second and fourth Fridays of the month. So my biggest thing is, as long as somebody knows how to vacuum, which you guys are going to learn today, then they can come take my class. So I've been a pelvic floor PT or physical therapist for 16 years. And I treat any type of dysfunction in the pelvic area. So I treat women and men. I do a little bit of pediatrics, not much. I actually have a colleague that does that. So I send them to her. So we do a lot of like pediatric pelvic floor. So kids that are still bedwetters, maybe the age of 5, 6, 7, still having accidents at night. She'll treat those clients. And then I mostly treat women postpartum, pregnancy, menopause, all of those lovely things that women we go through. And then I do treat men as well. So I see a lot of testy pain, penis pain, post-prostatectomy. So this technique works for everyone. It even works for a lot of my clients that have low back pain, neck pain, any type of spine dysfunction. I feel like it works really well with that type of population as well. Yeah, do you have anything to add before we get into?
No, I think that's a good kind of introduction about what we are going to be doing today with you all. So really for the personal training side, I think it's really vital to understand this technique as we are breathing through different movements and make sure that we are not having all of that extra intra-abdominal pressure pushing down on a lot of our organs. And so you hear often, the core bracing, which serves a purpose. However, during a lot of movements, we just want to be really careful that we're not doing that, especially with the type of clientele that I work with, right? The perimenopause, menopause, postmenopause, and then of course our prenatal and postpartum clients. So I think it's really important to understand that this is a full movement. It is not just breathing. It is not just vacuuming, but it has a bunch of different dynamics that we're going to be going through today. So we're going to get started and kind of go through what some of these movements look like, and kind of start from the very beginning with teaching the very basics of this. And then we can move into the actual poses and why that's important as well. So with that, you're going to see the camera's going to change a little bit as we're kind of moving through this. So just bear with us as it gets a little shaky.
Yeah, so I'll talk a little bit here first just about what it does. So we talk a lot about our diaphragm, right? So our diaphragm, oh, hopefully that camera goes to Melissa's face, not my hands. So we talk a lot about our diaphragm is here and our pelvic floor is down here, okay? So our diaphragm and pelvic floor move together. So as we breathe in, and you guys can start to feel maybe underneath your rib cage, if you want to kind of feel kind of through that rib cage angle and kind of push underneath. I'm sorry, our diaphragm, our camera's kind of going wonky here. So start to feel right underneath that diaphragm. As you breathe in, you can feel your fingers might get pushed out a little bit. And we'll go through this a little bit more when we go down to the floor. But as we breathe in, that diaphragm drops, okay? And then what goes along with it is the pelvic floor. Because of the fascial connections the pelvic floor and the diaphragm have together, they run together. So as we breathe in, pelvic floor drops. As we breathe out, our pelvic floor lifts. So what happens in most of our functions is we get stuck in this inhalation. So our diaphragm gets stuck down. Okay, so we're kind of in this downward position of our diaphragm. So guess what's happening to our pelvic floor? Our pelvic floor then gets stuck down. So a lot of times when people have constipation issues and they can't have good bowel movements, is they have no more drop of that pelvic floor. So we want to work on lifting things back up. So that's the whole point of the vacuum, is to bring this diaphragm back up into its apex and kind of create this dome again of the diaphragm, because we're kind of stuck like this. So if we can do that dome again and bring that diaphragm back up, guess what comes with it? The pelvic floor. It actually gets lengthened back up instead of putting that pressure back down. So everything moves with it. So if you're dealing with some issues of prolapse, right? We think of the uterus and the bladder. We end up pulling that uterus and bladder back up. So we have the uterus and bladder being pulled back up. Now we have less pressure on the pelvic floor. So now, therefore, sometimes our Kegels work a little bit better, right? So we have this better function of the Kegels. So that's the whole kind of purpose. And then with low pressure fitness, not only are we doing the vacuums, that's one part of the technique. The other part is we're learning postures. So we're learning some posturing principles to help functionally improve our myofascial tension. So we think about our fascia system. Our fascia system is all connected through our body. You think about fascia, when you go pull that chicken bone or that chicken off the chicken bone and that white stuff comes off, that's fascia. It's interconnected through all of our muscles. It surrounds all of our organs. So when we're getting that fascia to lengthen, and that's what these postural principles that Melissa is going to go through here in a second, those postural principles are very key. We do them in a way to lengthen that myofascial system. And actually a lot of postural principles fire the transverse abdominis and lengthen it in a little bit better way. So we've all been taught of tightening our core, right? Tightening our lower core, where this is actually going to slide that lower core even better. So people that have a rectus diastasis, that split of the abdominals, it actually helps tightening and corset a little bit better than just normal contraction of the lower belly. So we're going to get into these postural principles. Now, there's 4 main reasons why this vacuum is going to be difficult for you, and you might not get it down today. One is we're going to work on closing the glottis, closing through our throat here and closing the end of that. Some of us might have a hard time with that. So down the road, this is why sometimes doing a one-on-one with Melissa or a one-on-one with me, we might have to go through those things individually with you to understand how to close those things. We'll try to go through it and kind of work through it today a little bit. But that's one thing that kind of has a tough issue. The other one is our diaphragm might be really, really tight. So if you're sitting there right now, start to put those fingers underneath the diaphragm, underneath the rib cage, can you actually get those fingers up and under the rib cage? If you can't, that diaphragm might be really, really tight, or is it really painful? Sometimes that diaphragm is going to be really painful and you're like, oh, I can't even get underneath there because it hurts too bad. So sometimes that diaphragm, we have to do a lot of preparatory work to get that diaphragm to move a little bit more. So that could be another reason why some of this vacuuming and stuff might be hard for you. 3 is our abdominals get too tight. So a lot of us tend to overly contract and brace our abdominals. And so when we go in that vacuum, our abdominals, our obliques actually pull our rib cage down. So the whole point of the vacuum is to open our rib cage back up. And if those abdominals, those obliques are tightening down there, a lot of times that vacuum is really, really hard to do. So we work on releasing the abdominals. And then 4, a lot of us might have weakness in some of the muscles that we're going to be using today. So we're using a lot of the intercostals that go around the rib cage. And then we're using a big muscle called serratus, which sometimes can be very, very weak. And so if those muscles are really weak, it's going to be hard to vacuum. So those are the things that Melissa and I, when we see our clients, we go through those like kind of 4 things of why is the vacuum really, really hard? Do we need to do some preparatory work to get that vacuum to achieve a little bit better? So we'll kind of go through here at the beginning of just some basic breathing stuff to start to get you guys to feel of where we should be breathing at. And if you guys have questions, we'll try to end, 10 minutes early or 5 minutes early to answer questions. We can hang out a little bit, probably post the 2 o'clock window as well. So, but we want to teach you some of the basic principles that you guys can start doing right now. And then we'll get through actually one of the poses so you understand some of those postural principles that we work on. So if you guys feel comfortable, we can move to the floor. So if you guys want to move to the floor, or you can just watch us do these things too and try to do them in your chair, that is perfectly fine. If you want to share your camera, Melissa and I will both kind of try to peek up there and try to guide you through some of this. But we're going to start on the floor and just kind of feel our breathing technique. Do you want to have to adjust the camera a little bit?
Do you want to mention the contraindications?
Oh yeah, sorry. And then contraindications of doing this is 1, if you have high blood pressure and it's not controlled. So if your blood pressure is higher than the 120/80, which is our normal blood pressure, this will rise your systolic blood pressure by 40 millimeters of mercury. So we want to make sure that your blood pressure is nice and controlled. So whether you're on medications or you just have a normal blood pressure, then you're fine. If you're pregnant. So obviously we see Melissa over here. You probably don't see her, but she is pregnant. So she will not be doing any vacuums today. You can do all the posturing stuff. You can do the breathing. You just can't hold your breath and do the vacuum. So most of all the contraindications is to the vacuum portion of this, not necessarily to the actual just pose and getting into the position. Sometimes glaucoma. So if you guys have some glaucoma, again, it's to the vacuum because it's going to create more pressure in there. Infections, we usually want to wait. And then if you've had any like abdominal surgeries, so if you've had, a hysterectomy or hernia repair, anything in this abdominal area, we want to wait. If you're postpartum, we usually like you to wait. If you've had a vaginal birth, about 6 to 8 weeks, probably about 6 weeks is probably good. And then if you had a C-section, we really want to wait to 12 weeks. So any abdominal surgeries, we wait till about 12 weeks to kind of start to do the vacuum. Again, you can go through all the beginning stuff we're going to do here until we get to that vacuum, and you can do all the posturing principles. It's just mostly to the vacuum is the precaution. So just be careful with that. And I'll let Melissa, I'll lay down so you can see it, and then I'll have you, so you can see the positioning.
Get this to move down.
Move. Oh, well, there we go.
A little too fast here. No, you're fine.
Move up. Oh, you're going to move me?
Yeah, you're good. You stay there.
Okay. All right. Do you feel comfortable laying on your back?
Yeah, I can lay on my back. That's fine.
All right. So I'll have Melissa lay on her back here. Hopefully it gets Melissa and not me. All right. There we go. All right. So let's put one hand on your belly and one hand on your chest. Okay. It's picking me up, not you.
I should be able to change that maybe.
I'm going down here next. Okay. Let's just start feeling. I know you can't see Melissa, but let's just start feeling. I just want you to take a breath in. Okay. And I want you to feel, where do you feel like that breath is going? Is that breath going all the way up into your chest? Do you feel your shoulders rise as you breathe in? Do you feel your belly rise all the way up as you breathe in? Where are you feeling that breath? Okay, just kind of pay attention where that breath is kind of coming in at. Then I want you to take your hands, take the inner web space of your hand right here, and you're going to go around your ribcage if you can. If that is too hard, there we go. Now we see Melissa. If that is too hard, go just have thumbs up and just kind of go around the outside of the ribcage. So if the inner web space like this is too hard, just go here. Or if that's too hard, you can crisscross your hands and go like this as well. Okay, so if your shoulders don't allow you to go around, then I want you to breathe in again, and I want you to feel, what do you feel? Do you feel your rib cage moving? So what we really want is, I'm not a big fan of belly breathing. Okay, so I know a lot of us have been taught to belly breathe. There's no big function for belly breathing. Okay, so we want that breath to come laterally. We want to think of our rib cage expanding and lifting up and then slowly returning back down. Okay, so I want you to really start feeling that expansion of the rib cage, like it's laterally lifting and lifting up and then slowly returning. So some of us might feel this big quick return of our rib cage back down. We want to slow that rib cage coming. Okay, keep going. So we want to feel that rib cage expanding laterally. And then as we exhale, it's almost like we're melting our belly first, and then our rib cage is nice and easy coming back down. Good. And then breathing in, opening that rib cage. Exhale, slow and controlled. So I always like to do a 2-second inhale and a 4-second exhale. Okay, so let's think about breathing in for 2, 1, exhale for 4, control that rib cage back down, 2, 1. Good, breathe in again for 2, 1, really feel that lateral excursion. Exhale for 4, 3, 2, 1. As you start to breathe in again. Feel even underneath your armpits. Do your armpits expand? Exhale for 4. Control that rib cage back down. Good. Breathe in for 2, 1. Really feel that excursion. Exhale for 4. Good. Now we're going to try to move it to 3. Second inhale, 6, exhale. So breathe in for 3, 2, 1. And then exhale out through your mouth for 6. Good. Feel that rib cage slow and controlled back down. Good. You're going to breathe in through your nose. Open up into the rib cage. Exhale out through your mouth, nice and softly. So what I don't want to see is a like forcing that air out. The reason I breathe out through the mouth is because it's less resistance compared to the nose, right? Think about the nose is a lot smaller, so it's going to put more resistance. So if you are an ab gripper and you breathe out through your nose, you might fully pull that rib cage down really fast. Okay, so nice and controlled breathing out. So breathing in for 3, 2, 1. Exhale out through the mouth for 6, 5, 4, 3, 2, 1. Good. Feel how that feels. Good. So I like to do that breathing where it's that 1-to-2 ratio and control that exhale. So a lot of times when we're coaching through this, we will coach through that kind of timeline, like where we're doing a 3-second inhale, a 6-second exhale. Okay. Now I want you to take your fingers and I want you to start on your left side. We're going to do left side first. And I want you to start up by the apex. So it's kind of like right underneath your sternum. Yep. And you're going to start on that left side and you're just going to try to reach up underneath the rib cage there. And I want you to pay attention. Is it painful? Is it tight? Okay. Can you get your fingers up and under the rib cage? Okay. Or do you feel like, and how far do you go under? Do you get like 1 knuckle in? Can you get 2 knuckles in? Okay. Or does no knuckles go in? Like, is it really, really tight where you can't get any knuckles in? And just kind of feel along that rib cage. This is where we feel one of those principles that kind of makes it hard to vacuum, is sometimes our rib cage is just so tight. And then work your way down. Does it get tighter as we go down, or does it loosen up, or does it get more painful or less painful? And sometimes just holding that, if you find a spot that feels really, really tight, You can literally just hold your fingers there and just relax. Breathe gently during this. Don't take huge inhales. Okay. If you take huge inhales, on your inhale, your finger's probably going to get ejected out. And even some of us on our inhale, our finger might get ejected out because we might be really tight and stuck down into that inhalation. Okay.
And don't hold your breath.
And don't hold your breath.
Don't hold your breath.
Yeah, don't hold your breath doing this. So breathe nice and gently, just not huge, big inhales, big exhales when you're doing this. And kind of just work your way down that angle of the rib cage. And remember, we're going to go all the way down where we kind of go to it's like a little point at the bottom. Okay, it's our last rib cage on the bottom here. So just make sure you work all the way down that rib cage and just kind of feel what it feels like. So I start this a lot in a lot of my classes. I'll start some type of diaphragm release, whether we do it with our fingers, whether we do it with the ball. Sometimes I'll do it on the side of my hand and I'll glide down the side of the rib cage. I'll do this laying on our back. I'll do it laying on our side. I kind of do it in all different positions. Okay, so just start to feel like, what does that rib cage feel like? Good. And then now we're going to flip to the other side. So now let's do our right side. So start at the apex, which is up close to the sternum here. And you're going to start under that right side. And you're just going to work again. And then pay attention. What side feels tighter? Okay. Is there one side that feels tighter than the other? Or is one side a little bit more tender? I know for me, I'm more tender on my right. Most of my clients are tighter and more tender on the right side. Probably about 95% of my clients are. I think the reason is our liver's on that side. So our liver, I think, gets stuck down. So most of us are in an out flare position on our left, and our right side is like adhered down. So you might start noticing when you're working on that lateral chest breathing, it might be easier to breathe into that left side. It might be harder to breathe into the right side when you're trying to open up that rib cage. So focus on that when we get back into the breathing here. But work your way down now that right side and just kind of start at the apex, feel yourself under. I know Melissa's tighter here on her right, and I think this is probably the side of her surgery as well. Mm-hmm. So she gets very, very tight on this right side, but it actually feels a lot better than it did when I tested it probably 6 months ago. Yeah. So just kind of working into that side. So I'm just taking my thumbs, but I would just take your fingers. Sometimes you can take the lateral hand. If you guys have a lot of arthritis in your hands and this is hard for you, sometimes I'll take a ball and I'll just stick that ball right in the middle. And then I just work the ball down the side of the rib cage as well. And just kind of compare sides. Like, does one side feel a little bit tighter than the other? Okay, and you can kind of feel down and make sure you work all the way down. A little more gut punchy.
Yeah, that's where my scarring and stuff is. Yep, I got scar tissue.
And it might feel like a gut punch. That's how it always feels to me. Like when I'm really tender, like I took the breath away. Like all of a sudden I can't breathe. You guys might also feel when you're going down through here, you could feel some scapular pain. Okay, sometimes if your diaphragm's really tight, that will refer to your scapula area. So just know that sometimes pushing through here, you can kind of feel some radiation pain. I would just kind of lightly hold on to that until that pain kind of melts or you don't feel it as much anymore. And just kind of give a nice little pressure working your way down that rib cage. You can also take massage cream if you feel like you're really tight on one side and just glide down that whole side of that rib cage. This is safe to do when you're pregnant. Obviously, she's pregnant and we're kind of going in here. So this is an easy one. If you can't lay on your back this long and you're pregnant, I'd advise laying on your side, doing one side at a time. Working that way down. So now that we've kind of worked that diaphragm just a little bit, let's go back, put our hands on around our rib cage, okay, that inner web space around, and let's start to feel that breath again. Do you guys feel any different as you breathe in through your nose? Open up that rib cage, breathe out nice and gently through your mouth, slowing that rib cage back down. But make sure that rib cage does come all the way back down because some of us might stay flared out. So make sure you nice and easy bring that rib cage down. Don't over exhale though, where all of a sudden you start to grip your abs. Okay, breathing in through the nose for 3, 2, 1. Exhale out through the mouth, nice and slowly. Good. 3, all the way down. 2, 1. Good. Breathe in again for 3, 2, 1. Exhale for 6. Nice and controlled. Feel that rib cage come back down. Now, keep breathing here as I'm talking, the 3-6 breathing. When we work on our vacuum, so imagine we talked about the diaphragm's up here, the pelvic floor is down here. When we breathe in, that diaphragm is dropping, right? When we breathe out, the diaphragm is lifting back up. So at the end of our exhale is where we end up holding our breath, okay? We don't want to start the vacuum at the end of the inhale because now all of a sudden I have to vacuum and my diaphragm's all the way down here. I'm going to have to lift it all the way back up. So we want to, at the end of the exhale, we pause. I always say close nose, mouth, and throat, okay? So what we're going to do is we're going to end up pinching our nose, okay? At the end of that exhale, you're going to pinch your nose, not let any air in, but it's like you're sucking air in and you're still going to try to open up your rib cage, just like you would be if you're breathing air in. Okay, so that diaphragm, I'll just show my rib cage here.
Yep.
So we breathe in, we open up that rib cage, we exhale, slowing that rib cage back down. At the end of that exhale, I'm going to take my hand, plug my nose, which I know you can't see here very well. Sorry. Now. All right, let's breathe in again. So breathing in, exhale, nice and slowly rib cage comes down. You're going to pause, plug your nose, and then vacuum, sucking in like you're sucking air in.
No air should be coming in at all.
And then you hear that big release from me, that pop. Okay, I'll go through it again here. Breathing in, opening the rib cage, exhale, slowly bringing that rib cage back down. Pause, close nose, mouth, and throat, and vacuum. Breathing in. Okay, so go through it. Don't do a lot of vacuums right in a row. We're going to teach you here, and I'm probably going to do a couple rest breaths, and then we'll go into vacuum. Sometimes as well, at the end of the exhale, when you pause and plug your nose, you can swallow once. Sometimes that swallowing will help take that glottis and throw it over the trachea, so then you can't let air in. Okay, so let's try this. Melissa's going to pretend that she's doing a vacuum, but she's obviously not going to vacuum. Okay, let's lay on your back. Okay, and I'm just going to guide you guys through this how I would guide somebody, all right? So let's breathe in through our nose. You're going to breathe in, open up that rib cage laterally. Exhale out through the mouth for 6, 5, 4, 3, 2, 1. Let's breathe in again through our nose. We aren't vacuuming it. Good, breathe in. Open that rib cage. Exhale, this is breath cycle number 2. We're going to do 3 breath cycles here before we vacuum. Rib cage comes down. Breath cycle number 3. Breathe in through the nose. Exhale, we're going to prepare for our vacuum. Nice and easy. Bringing that rib cage back down. Good. You're going to pause. Plug your nose. Swallow. Try to bring air in, but don't let any air in. Okay? Like you're sucking air in. Open up the rib cage. Expand laterally. Good. And now release everything. Let the air in. Sometimes you'll hear a little pop. Okay. Let's try that again. Breathe in through your nose for 3, 2, 1. Exhale for 6, 5, 4, 3, 2, 1. Breathe in. Breath cycle number 2. Breathe in for 3, 2, 1. Good. Exhale for 6, 5, 4, 3, 2, 1. There's breath cycle number 2. Breathe in again for 3, 2, 1. Open that rib cage. Exhale. We're going to prepare for our vacuum. Nice and slowly bring that rib cage back down. Pause. Swallow. Plug your nose. Open that rib cage. Don't let any air in. Try to expand that rib cage. Good. Expand. And breathe in. Good. And exhale. Okay, let's open this up for a little questions in case somebody has questions, because I know that was really hard, and then we can go through, you can teach us through Demeter. Okay, does anybody have questions about that? How was that for everyone? Because I know it's hard to do a vacuum. Anybody have questions at that? Were you guys able to get it? Did you guys have any difficulties doing it? Thumbs up, maybe if you were able to get it. Thumbs up. Okay. All right, so that is the vacuum. So how we do a lot of our breath cycles. So now Melissa's going to take us through the postural principles of one of the poses, okay? So we're going to go through a pose called Demeter. She's going to go through a lot of the postural principles of how we need to position ourselves. And what I usually do at the beginning, I do 3 normal breaths to 1 vacuum. Then I do 3 normal breaths to 1 vacuum. I don't do a lot of vacuums back to back to back because I don't need people to pass out, okay? And then just hold your vacuum. Sometimes I cue that beginning vacuum 4 to 6 seconds, okay? So sometimes we'll do a breath hold test to figure out where you really lie, but most of us lie between that 4 and 6 second breath hold. If you feel like that's difficult, obviously back off, don't hold it as long. But Melissa will take us away and go through Demeter.
All right. So Demeter is also going to be on your back. So this pose, I have Ashlea lie down. Yeah, I'll move this. You're good. Oh, I got a comment. Maureen says, I think I got it. I want to read this real quick. Yeah, it seems challenging, but love a good challenge. Great. Can we do the standing up? And how often do you suggest doing it? How many times per day? Yes, you can do the standing up. So there are several poses that we can actually go through. Most people, what we found, it's a little easier when you're starting on the ground to really get the actual flow down, the dynamics, and being able to actually laterally expand those ribs. So typically this is a good one to start laying down. But there are some poses that we can show you too at the very end that are standing. So you'll get to see a little bit of both. As far as how many times per day, I like personally, I like to do this 3 times a day, like at least. Like you wake up in the morning, it's a good way for me to kind of start my day and kind of reset the body. And then midday, and then before bed. So that's me personally. I don't know.
So the research actually show a lot of my clients will take 1 or 2 poses and do throughout the day. The research behind this is once you know, I would say about 4 to 6 poses, you can go through your own flow. And the research behind it is 2 to 3 times a week for 25 to 30 minutes. So I always feel like our first vacuum is not going to be as good as our last vacuum. Mm-hmm. So think about the fascial tensioning. So towards the end of that 20 to 30 minute mark, I'm going to be probably eccentrically guiding my diaphragm up a lot higher than I would be in that first vacuum. So usually they've seen a lot of the research studies they've come out with is about 20 to 30 minutes, 2 to 3 times a week. And that was, I think, a research study. They did it on stress incontinence. One was on low back pain, and another one was on prolapse. So a lot of this is done with like pelvic floor dysfunction stuff, but there is a research study on low back pain. They've done a lot of research studies on they have a research study on basketball players, like it was some elite athletes. They did a recent one out here in May to show the difference of intra-abdominal pressure. I would say we alter abdominal pressure. We don't change it. So we alter the way the pressure is happening. We don't necessarily decrease it. That's what I should say. We change the pressure. We don't decrease it. The research study did come out where they didn't really significantly find a change in that pressure, or I should say a decrease in that pressure. Some people did have a change, but the study was only a 2-week study. So I feel like the study needed to be a little bit longer because usually they say about 2 to 3 times a week, 20 to 25 minutes, about 6 weeks is when people started to feel those changes. So that's just the research behind it. But
yeah. So to see changes, you don't need to do this very often, but that doesn't mean that you can't do it more, right? Obviously, the more we do this, the more results you're going to see. However, based on the research, you are going to see results with as little as those 2-3 times a week for that 20 minutes. So yeah, great questions. And yes, this is challenging. So it's not often that you get it your first time. but keep at it and you will. I promise you, you will get this. Okay, so the first pose that we're going to be going through is going to be Demeter. As we mentioned, this is going to be lying down on your back. There's going to be a couple different things that you need to keep in mind as we're going through basically all poses within this low pressure fitness principle. So we always want to make sure that we are elongating at the head, right? We don't want your head tilted back. We don't want the chin tucked under. We want to make sure that we are keeping our head nice and elongated here. Shoulders, we don't want them hiked up. We don't want them like really pushing down and putting all that pressure maybe on the back. So in a neutral position, but we also want them lengthened, right? So we want basically your shoulder blades to be lengthened out as much as you can. So if we have our arms pointed straight up, you should have some separation underneath those shoulder blades, right? So we are, again, kind of elongating, right? Now, we're going to put our arms kind of down by our side. Fingers, I want them kind of spread out. We don't want lazy kind of hands, right? So fingers spread out. Everything that we do is going to be very intentional. We don't want anything to be just relaxed and kind of lazy. Everything has a purpose. If you have shoulder pain, of course, being a little bit lower is going to probably be a little easier for that. However, this position, we have low, mid, high, so we can move our arms out to the side, and then we can have them pretty far up, which I'm in your way, but yeah. Another thing to keep in mind is the back, right? So we want to make sure our pelvis is in neutral. So a good way to find that neutral pelvis is to put your hands kind of on, like basically making a triangle, right? And we want to see where that pelvis is. We don't want you laying back and arching that back, but we don't want the pelvis tilted too far forward either, where you're kind of flared up towards the sky, right? So find that neutral pelvis. Most people, as this was just kind of like social media many years ago, right? We always talked about how we want to push our back into the ground. That's not necessarily the case for most people. Most people are going to have a little bit of a gap underneath their back, and that is okay because your pelvis is likely in neutral. So if you push your back into the ground, your pelvis is likely shifted, right? And now we're pointing up to the sky. So we don't want to do that. Make sure that we are in neutral here. Your knees, we want them to be hip width. We don't want to be flared out to the side. We don't want them too far and caved in. So hip width apart. So nice and straight. And then now your feet. Again, everything has a purpose, and we don't want anything to be like super lazy. And we want to make sure that we are putting some pressure. So we are going to put those toes up, and we are going to have your toes basically in a dorsiflexion. So you're going to have your toes pointed up towards the sky here. So these are going to be nice and up. Arms out and stretched out, elongated, neutral spine and pelvis here, elongating the neck and the head. And this is basically your Demeter pose. Okay. Do we have any questions on the actual pose itself? Let me go look at this message real quick.
So make sure when you're growing that head, I just say long neck, long throat. Okay. So think about if you have a lot of kyphosis, you might need a tiny pillow behind your head, because I don't want like this, right? So if I have a lot of upper back curvature, I don't want my head like this. And I was actually treating somebody yesterday, and he does have this. So I had to do a little bit of pillow elevation to get him to lengthen his neck. Okay, so just be careful. None of this should be painful. There should be no pain, absolutely no pain when we're doing any of this. So if you get any tingling into your hands or any pain up in here, we need to either adjust or we need to back off a little bit. And then, yeah, just think about separating those shoulder blades like you're trying to get like the floor out between your shoulder blades. bringing those arms down, staying intentfully, trying to reach through the fingertips. And then, like Melissa said, dorsiflexing the feet. We dorsiflex the feet, we actually get better activation of our TVA. Okay, that's the main reason why we dorsiflex. So every pose we do, we're going to dorsiflex the feet. So, and then also I tell people with pelvic floor dysfunction, the innervation of the bladder and into the pelvic floor is the same innervation into the feet. Okay. Yep. So we reach through those arms and we dorsiflex the feet. Okay.
Yep. And the TVA, by the way, is your transverse abdominis. Oh, yeah. So that's your abs that are basically towards the bottom there. We did have a question about kind of going about your day. Something that you should try to be aware of with your breath, something you should not do. Yeah, going through your day, I would say like you can practice that breathing technique without the vacuum, and that'll still be very, very beneficial, especially for our runners, right? To be able to do that diaphragmatic breathing and breathing through that rib cage. So that is going to help with a lot of the running. You can do that at any point. You can be sitting in the car and just think about breath and put your hands around your ribs and see if you can breathe in and expand that rib cage. If it's not expanding, try to get in there, try to loosen up that diaphragm, see if that will help. But you can do that at any point throughout your day to think about. What we want to make sure that we're not doing is that belly breathing, right? So whenever you take in that big inhale, we don't want to see this big doming here, right? So this should be somewhat stationary. Most of the time when you're breathing in through your ribs, you are going to see it a little bit in the belly, and that's okay. We just don't want to see that big doming in the belly, right? So as you're going through your day, walking through some store, whatever, just think about breath for a moment and see, as you are just doing a daily breath, where are you feeling that breath? Are you feeling it through the ribs? Are you feeling it coming up through the chest? Are you feeling it in your belly? And just being mindful of where you naturally are breathing, that'll be a huge game changer, especially whenever we're going in and we're doing basically the poses and you have time to do the vacuum. It'll make the vacuum a lot easier because you're already used to expanding those ribs.
And just remember, you breathe 20,000 times a day, so you aren't going to feel this for every breath. Yeah. But over time, fascially, when you start working on the fascial system, naturally you'll start breathing into here more. And then right now, we're only teaching you this lateral chest breath. Eventually, we want that 360 breathing. So just understand, at the beginning, I just teach lateral excursion. We still want anterior chest motion too. We want posterior chest motion, but really focus first on just getting that lateral rib cage to move. I just don't want that apical breathing where you start to hike your shoulders up. Okay. And we don't want that straight belly breathing.
Yeah. Yeah. Just know breathing, you're using the entire trunk whenever you're doing a breath. So you are naturally going to see some rising and falling of the chest and the belly, but we just don't want it to be dominant in those areas. So yeah. Okay. So now in this position, this is when we are going to go through that apnea breath. So the breath holding, the vacuuming, where we're going to see that. So we are going to go through a breath. Do you want to start with 3-6? Mm-hmm. You want to do 3-6? Okay. So we are going to take that inhale. We're going to inhale for 3, 2, 1. Exhale, 6, 5, 4, 3, 2, 1. That's breath 1. We're going to inhale again for 3, 2, 1. Exhale for 6, 5. Make sure your head is elongated, right? Toes up. And then go ahead and do another breath. This is your third one. And then exhale, arms nice and elongated. And then here is where you're going to pause. You're going to close nose, mouth, throat. And then you do your apnea breath. And then you'll see the doming here. I'll move the camera here in a minute, and then we can actually get a varial. And then breathe in. Good. And then we go back into that same breath pattern. what I'm going to do now is actually move this camera so you can get a top-down view of what this looks like. So actually, I'll have you come a little closer, and then I'll have you get right underneath the camera so we can actually see.
And just remember, we typically lose our posture on our exhale. So on your exhale, think about lengthening that neck, spreading the shoulder blades, reaching through the fingertips. If you're hypermobile, do not lock your joints out. I don't want to see this like shoulders coming off the ground. So keep those shoulders, keep reaching through the fingertips. Sometimes I actually start with a Barbie hand, okay, instead of opening the fingers right away. So think about kind of reaching through that Barbie hand, dorsiflexing those feet, make sure that pelvis stays neutral.
All right. So same concept. We're going to do it again. We're going to do 3 breaths, and then we'll do that apnea. So we're going to do that inhale for 3, 2, 1, exhale. Good. And then we're going to inhale again for 3, 2, 1, exhale, making sure we have the elongation, separating, toes up. And then 3rd breath, inhale, 3, 2, 1, exhale. Okay, now we're going to close that nose, mouth, and throat, and we're going to do that apnea breath. And here you'll see the ribs. And then we're going to inhale. And then as you inhale, those ribs are coming back out as they normally should. So that, my friends, is the beginning of low pressure fitness and what that looks like. We have just over 10 minutes left. So we're gonna show you a couple different poses. We're not gonna go through them in depth, but since we were asked about standing in different poses, we'll go through a couple of them so you have a general idea of how many poses there really are and what you can actually do with this. So
do you mean to guide you through Athena or a
yeah,
Venus?
we can do.
Let's do Venus.
Venus?
Yeah.
Okay. Do that.
So usually when I teach my class, I usually will do like a 20, 25 minute warm up, depending on what we need to work on. So I always add in the diaphragm stuff. So I might be doing some scapular work. Maybe we're working on some rotation in the T-spine. Maybe we're getting understanding like hamstring activation, things like that. So there's a lot of different ways we can warm up. And then I go into a flow. So I usually start in standing. I usually end in like Demeter. Okay, so we want to go through our feet here again. I don't know if you can see Melissa's feet.
Do you want me lateral? Like what?
Yeah, we can do lateral first.
Okay.
So we go through the same concepts of ankle dorsiflexion. Okay, so we think about, feet. I'm just going to go down just a little bit or tilt it. There we go. Thank you. Yeah, perfect. Okay, so we think about, we want our feet nice and neutral. So one way to find it is you can put your heel right into the arch of your foot. And that's how we know how far our feet should be apart. So make sure we aren't too wide through here, okay, or too narrow. Put that heel right into the arch. Then we know we're shoulder width apart, okay? So we start with the feet, okay? Let's turn lateral so they can really see you laterally, which way you want to go. There you go, okay. So, and then we want to think about, we go through the knees. A lot of us like to hyperextend our knees, okay? So we want to unlock our knees a little bit. Try not to lock them too much where you're in a squat position, just enough. I always think, pretend like I'm in a ski boot. So I always want to pretend like I'm kind of pushing into that ski boot if you guys have ever skied before. And that's how I usually want my knees. Then I go through the pelvis, okay? So here's our neutral pelvis. So obviously with Melissa, I work a lot with pregnancy and pregnant women. I always think, yeah, we don't want to have our bucket tilted forward, okay? But we don't want to be overly tilted back. It's probably going to be hard for Melissa to do that since she's pregnant. Yep. Okay. But most of us probably overly tilt our bucket forward. So sometimes you can take both hands, put one behind. Sometimes I'll do the back side of my hand if I can't get my range of motion. And I do the front side of my hand on the other side or back and back. And kind of just feel around with that. Kind of tilt your bucket forward and backwards. Okay. And understand like what position that bucket should be in. We should have a neutral bucket. Okay. We don't want to empty our bucket forward or behind. Okay, so we think about that nice, relaxed. I always think of that tailbone dropping down to the ground. It really helps to unlock the knees. When we lock our knees, we tend to tilt our bucket forward. Okay, so unlock the knees, let that bucket tip back. Then I kind of come up the spine here and I look at the rib cage. Okay, Melissa's probably starting to be in a little bit more thrusted position open or like rib cage flare, or I call this bell rung up. Okay, so we want to make sure her bell comes back down a little bit more and she lengthens and elongates through that spine. Okay, so we want that bell to stack over our bucket. Okay, then we kind of go through our arms. So sometimes I'll start in that position coming forward. So I have Melissa reach forward just a little bit. Almost we want a little separation of the scapula. Okay, then I'll have her bring her arms down into that almost like 30 degrees away from the body. So I think about too in Venus, I like to see my arms, my periphery. Okay, so I don't want them back here like this. Okay, I want Melissa to be able to see them in her periphery a little bit. So she's lengthening and engaging. Again, if you're hypermobile, I don't want to see this hypermobility where the shoulder comes forward. Melissa probably has a lot of hyperflexibility. Or I always say that fold in our elbow. I was treating a client this morning and she's like this, and it's like almost tilting up. Okay, keep that fold in the elbow facing forward. Okay, but it's that little reach, almost like you're reaching through the armpit. I always think I'm scooping the armpit and reaching a little bit away. Okay, so it's very mindfulness kind of moving through there. Okay, so Melissa's in this nice elongated position, separated the shoulder blades, lengthen the neck. So think about the crown of the head is going up. We call this a lot of axial elongation. I really want her to lengthen through the crown of her head, long neck, long throat. Okay, she's in this perfect position. Now, how do we get that ankle dorsiflexion? Is we do a tiny little access forward. So make sure when we're accessing forward, we aren't doing this, making our butt or our pelvis go first, or leading with our chest. Okay, so she wants to come here in this nice elongated position, growing tall through the crown of her head, and then nice little shift forward. Okay, now breathing in, open up into that rib cage. Exhale, keep growing nice and tall, lengthening the neck, lengthening those shoulders. Good. Let's breathe in again. Cycle number 2. Breathe in for 3, 2, 1. Exhale, make sure those knees are unlocked. Good, relaxing the back, growing tall. Good, breath cycle number 3. Breathe in for 3, 2, 1. Exhale, keep reaching through the arms, keep growing tall, crown of the head. Prepare for apnea. Pause, close nose, mouth, and throat. If you still need to do that nose pinch, pinch. Melissa's not going to do it here. She's going to pretend. And vacuum, opening the rib cage. Think about opening, gliding that rib cage up. Good, still lengthening tall. And release, breathe in. Good. Okay, and then we could move to mid-Venus arm if we wanted to, as long as our shoulders. What happens a lot, I see this a lot, when people come in here and they're doing their shoulders, they start to go like this, right? Look at my bell. My bell is now ringing up. Okay, so we want to make sure, sometimes doing this on the wall, I always say come back to the wall. You can put almost your heel touching, but I say like a fist length away from the wall. Depends on how much booty we have. Okay, if we have a little bit more booty and shape back here, we want to be maybe a little bit away from the wall. If we're very flat and no booty, we want to be closer to the wall with our heels. So sometimes aligning this up with the wall helps, because then you can kind of see, like, am I having a lot of room back here, or can I kind of barely smash that cherry tomato back here? Okay, and elongate that way. Then you can access forward. Sometimes I like doing that off the wall. Okay, is there any questions with that one? And we can even open this up if you guys want to actually just ask questions. You can unmute if you want to and ask any questions with that. But that's just those are 2 of the poses that we teach. In level 1, we have about 13 poses. In a class, I probably go through about maybe 6 poses. And then there's a lot of different variations as we progress. Level 2 and level 3, we start adding in crazy arm movements and all this other stuff. So.
I know Morgan mentioned recording. Yes, this is recording. However, I don't know if I am going to be sending it out. It depends if I can get, of course, a release for those who are on camera and anyone who has, spoken. Of course, we want to protect privacy. So I will send out a release to those of you on this call, you know, if you're comfortable with me sharing this out, then I would really appreciate it. And we're trying to, of course, educate as many people as we possibly can. Are there chair poses? Well,
I mean, there's a lot of modifications that you can do.
Sure.
So they're all, I mean, you go through those postural principles, right? Think about if you sit on the edge of a chair, how do you axial elongate through the neck, right? Is your pelvis in neutral? Is your diaphragm in neutral? How are your shoulder blades? So you can really do this in any pose. There's lots of modifications.
Your feet, right?
Yep.
Keep in mind your feet in a chair.
Yeah, we do a pose called Hestia, which is seated on the ground, but sometimes a lot of my clients can't get to the ground. So I'll usually sit them up in the chair. So yeah, usually you can kind of modify this into any poses, but we have poses on our hands and knees. We have poses standing, sitting, all that stuff. Karen, be careful doing a lot of the vacuuming right now, just because it will pull on that fascia right there. And I think that's it. And I know Melissa has her contact in here, so feel free to, you know, reach out to Melissa, do a one-on-one, right? Kind of, if you want to learn this technique a little bit more, that's probably the best way, is to learn a little bit more of doing a one-on-one. And obviously, if you live here in Colorado, you can come see her one-on-one. You can see myself. Obviously, if you live in Florida, like some people do on here, you can do a one-on-one online. I just make you feel everything, where you can kind of feel and try to really get that rib cage to move as best you can. But sometimes we're limited with a little bit of online stuff. And we can always look if you live out of town too. There is some low pressure. I think if you get on their website, Low Pressure Fitness USA, Becky Keller, she is the North America representative of Low Pressure Fitness. You might be able to find somebody close to you where you live that's been credentialed. I know we have some friends that we want to help in other states too. So yeah, you can always look on their website and find somebody hopefully maybe close to you.